Hey everyone, and welcome back. I am so glad you're joining us for today's explainer because we are about to decode a seriously cool architectural secret about the human body. Have you ever actually stopped to wonder how all your bones and joints manage to work together so seamlessly without just collapsing? Well, today we are visually unpacking the fascinating mechanics behind human movement. Oh, and before we jump in, you might notice our clinic branding with us today. Keep that in mind if you ever find yourself needing physical therapy or emergency pain relief, especially after we uncover how your body is actually supposed to move. Okay, let's dive right in. So, I want to kick things off with a question that touches on one of the most surprising secrets of our anatomy. Did you know your joints follow a strict, alternating pattern? It's completely true. Your skeleton isn't just some random stack of bones piled on top of each other. It's a highly coordinated, perfectly engineered chain. Every single major joint area has a very specific job, and those jobs perfectly counterbalance the joints immediately above and below them. It's an absolutely brilliant design, and honestly, once you see it, it's going to completely change how you understand physical health.
All right, let's look at part one, the body's hidden pattern. Take a look at this incredibly vibrant anatomical map. We've got an illustration of the human skeleton viewed from the back, and you'll notice it's marked with these really distinct, brightly colored zones: pink, blue, red, yellow, and green. And right beside each colored zone, there's a bold red arrow pointing to a specific word, either stability or mobility. Now, this isn't just colorful artwork. This is literally the kinetic chain of your body mapped out. We are going to decode exactly what these arrows and colors are trying to tell us.
Which leads us to a really important concept: stability versus mobility.
Okay, so the crucial point here is understanding the difference between these two vital roles. Stability is all about firmness and structural support. Think of it as your anchor. It is grounded, secure, and specifically designed to resist unwanted movement to protect your spine and your posture. But then, on the other hand, we have mobility. Mobility is all about fluidity. It's your range of motion. It is dynamic, it's active, and it's what allows you to bend, twist, reach, and walk. You absolutely need the grounded firmness of stability so that you can safely express the fluid action of mobility. They are essentially two sides of the same physiological coin. So let's break this down, starting with mapping the upper body. This brilliantly illustrates the pattern in action. Let's walk step by step right down the spine. First step, look at step one, that pink zone right at the neck, the cervical spine. The arrow points directly to stability, and that makes sense, right? Your neck needs to securely support the heavy weight of your head. But moving down to step two, we hit the blue mid-back, the thoracic spine. Here, the rule completely switches to mobility. This area is designed to twist and bend, letting your ribcage move fluidly. But then, as we travel a bit further down to step three, we hit the red lower back, the lumbar spine. And look at that, we are right back to stability. Your lower back is this thick, robust structure meant to provide firm support, not wild twisting. Pink for stability, blue for mobility, red for stability. It's basically a perfect structural sandwich. And moving right along, mapping the lower body. Continuing our journey downward, let's look at how the lower half perfectly mirrors the logic of the upper half. Following that stable red lower back, we drop into step one, the blue hips. And the arrow here proudly declares mobility. Your hips are ball and socket joints built for an enormous range of fluid motion. But travel just a bit further down the leg to step two, the yellow knees. Suddenly, the mandate is stability again. The knees primarily just hinge back and forth. They really rely on firmness and structural support. Finally, we reach the ground at step three, the green ankles. And just as you might expect by now, the arrow points to mobility. Your ankles have to pivot and adapt to every single uneven surface you step on. Which brings us to the complete joint sequence.
Just notice the rhythm of your own anatomy here. Stability, mobility, stability, mobility. From your neck all the way down to your feet, your body is stacked in this flawless, alternating sequence. Firmness, then fluidity. Support, then range of motion. It never puts two highly mobile joints right next to each other, and it never stacks two purely stable joints on top of one another. It's just a perfect, continuous chain of checks and balances.
Looking at the whole picture again, we can really appreciate this complete alternating pattern in a single glance. From the pink neck craving stability, down to the blue mobile mid-back, through the red stable lower back, into the blue mobile hips, down to the yellow stable knees, and finally resting on the green mobile ankles. So you might be wondering, why does this unbroken chain actually matter to you? Well, because if a mobile joint gets stiff, the stable joint right above or below it is forced to move to compensate, and that is exactly how injuries and pain happen. Understanding this unbroken chain from head to toe is literally the ultimate key to maintaining your physical health. And that is a wrap on our structural tour for today. If this explainer helped you understand your own body just a little bit better, please go ahead and like, share, and subscribe. Don't forget to press that bell icon so you never miss out on more useful, visually driven explainers just like this one. And hey, if you are experiencing pain because your alternating chain of stability and mobility is feeling a bit out of whack, be sure to visit our clinic for physical therapy and emergency pain relief treatments. The information is right there for you. Thank you so much for hanging out and learning with me today. But before you go, I want you to think about this. The next time you feel a mysterious twinge in your lower back or your knee, ask yourself, is that joint really the problem? Or is it just paying the price for a stiff hip or ankle right next door? Keep moving, and I'll see you in the next explainer.